Great health, it starts with great primary care. Noble Primary Care provides their patients with expert health care delivered by a group of experienced and compassionate physicians, and they just opened a very new location. So joining us to share more, we have Dr. Stanley Stremko and Dr. Brian Sutton. The new location, where is it?
So it's 57 Union Street in Westfield. It's conveniently located. It's on a cut through between Route 202, which is heavily traveled, and Route 20, which is heavily traveled. Brand new building, 15,000 square feet. And you know, Seth, we did some market research, and what we found was that patients were leaving our market, Westfield Southwick, to get primary care outside the market. They were also leaving our market to get acute walk-in care that didn't rise to the level of needing an emergency department outside our market, and we decided to address the need. So in the last 8 months, we've opened up this new facility, again 15,000 square feet. We have an express care side that Brian directs and is on pace to see about 10,000 patients this year.
Well, and it's on pace to see that many because of the wait times. We were talking about it earlier. Wait times have been slashed. Talk a little bit about that.
Well, we've done a pretty good job addressing patient flow issues at both the hospital side. So this freestanding building is part of the Noble Health Network, and on the hospital side, you know, we've got an emergency room now where our average door, you walk through the door to doctor time, you got a doctor in front of you, is 23 minutes. And that compares favorably locally, regionally, and nationally. And we've brought that same philosophy because Brian, by day, is an emergency physician, and then by other day, he runs the express care site.
And by night, hopefully, he sleeps.
Not a lot.
No.
He's brought that same customer service orientation and focus on patient flow to express care.
And like Stan was saying, we're on pace to see about 10,000 urgent care visits this year at Noble Express Care. It's just been such a resounding success. We've had a great response from the community. There was a need, obviously, for urgent care facility in the greater Westfield area. I think we're doing, well, according to the feedback, we're doing a great job addressing that need and continue to see large amounts of urgent care patients, you know, from the greater Westfield area.
Now, so throughout our system, you know, between the emergency department, the freestanding express care, we'll see a 33% increase in acute care visits in a single year. I mean, that's just, and it's a zero-sum game because in our market, if we're seeing somebody, it's not like the market's expanding. If we have a 33% increase, it means it's a 33% hit for somebody else. But clearly there was a service folks wanted in Westfield. We identified that. We provided it, and the community's responded. On the other side of the hall of that building, though, we've got 5 new primary care. Very high-quality individuals, and again, addressing this need for primary care within the market so that patients don't have to leave Westfield Southwick, the greater Westfield market, for primary care.
And we were seeing that a good share of our patients who come into express care early on were without a primary care physician. And so
well, it's nice to be able to have that connection.
now we refer them across the hall, and it's a win-win.
Well, and it's also great because, you know, one hand's washing the other. You go to your primary care, you go to your urgent care, and there's a need, and it's assessed, and then you're having constant communication, if you're in the same building, with the primary care physician.
And then so we've added 6 primary care, and a 7th joins us October 1st. But the Noble Health Network is in kind of a sweet spot in this way. We're a big enough system so that we can provide total care. That is, we have a network of employed specialists, gastroenterologists, we have, you know, orthopedists, pulmonologists, you know, right on down the line, a comprehensive breast health program. But we're small enough so you don't get lost in that system. And I think at the end of the day, it makes for good patient care and a good patient experience.
Now, this express care, what kinds of ailments should I have if I'm going to an express care?
Well, anything from a sprained ankle to a lacerated wrist to any bee sting, seeing you know, the small stuff that you would before, you know, go to an emergency department for, but we're certainly we'll see anything from you know, minor headaches, eye complaints, ear complaints, upper respiratory tract infections, like animal bites, things that would not constitute a life-threatening emergency. Like if you had chest pain or the worst headache of your life, or you think you were having a stroke or a heart attack, you would not want to come to Express Care.
But hitting on this theme of comprehensive care and total care, as an example, last Friday, Dr. Sutton was working at the Express Care site. I was in the emergency room at Noble Hospital, and twice during the day I got a call from Brian saying, hey, I've got a guy here who's really sick. He was hoping he wasn't really sick, but he is, and he needs a higher level of care, and he's in the ambulance on the way. So you've got that tight relationship between the ED, where we can provide a higher level of care.
The bat phone.
Yeah, that's what I was trying to imagine what sort of phone it would be, the two doctors that connect them together. Well, it's a great service that you're providing. There's so many benefits to it. So I want to thank you for coming on and chatting about. But if you don't mind, everyone's talking about West Nile and all these mosquito-borne illnesses. You want to stick around a little bit and later tell people in the show?
Love to.
That?
Thanks for the invite.
Absolutely.
Yeah.
Perfect, thanks. And if you want to schedule an appointment with Noble Primary Care, you can just call 413-572-6050 or visit noblehospital.org/primary care for more information.